My name's Dr. Enrico, and I'm a board-certified OBGYN at the Mankato Clinic. When I discovered the opportunity at this practice, it just seemed like the kind of well-rounded yet personal practice I was looking for. It seemed like it was going to be a good fit for me. And then also when we researched about Mankato and what kind of place it was and the strengths that it had to offer a family, then it all just came together from there. My family likes to get together with their friends, of course, and socialize. We also like to go out to the lakes and do some boating or some beach or some fishing. Things that are pretty common and typical and fun for this area. I'm a big sports fan and played sports my whole life. So since it's Minnesota, a state of hockey, I've started playing ice hockey a lot, and I've met really good people that are nice, and feel like I'm getting a little better, and I really enjoy doing that. My favorite things about being a dad are probably just the challenge. It's always a challenge, and kind of like the job. One of the good things about the jobs is it's never boring, and it's the never same thing 2 days in a row. And I guess you could say the same thing about parenthood. As soon as you think you figured out one thing about your kids, then they grow up a little bit more and start to change and respond and act differently, and then you have to figure that out. So there's always another challenge, so it keeps things interesting. There really isn't another discipline that offers that mix of surgery plus long-term patient relationship development plus the excitement of delivering babies. Sometimes whatever the problem is, there can be a very direct solution, or sometimes the problem can be from some underlying problem that they're not really even thinking of as contributing. And so I try to discuss and listen enough that I can get to the root of whatever the source of the problem is. And sometimes it's direct and simple. Sometimes it's more complex and might change the focus of the visit, even compared to what the patient was expecting before they came. I think my patients would probably say that they can tell that I really deeply care, and that I will try very hard and do whatever I need to do to try to help make their life better. At least that's what I'd hope they would think, because that's how I do feel about it when I go into each interaction. It's a little different, it's a little bit fun. I think it's a popular color amongst women, and all the patients are women, most of the nurses are women, most of the doctors are women, so it seemed to make sense to go that direction. And I get a lot of positive feedback and see a lot of smiles with it. So, being a husband and being a dad helps a lot, just because I use the term a lot that everything's going to be different, when I'm talking to a young couple, especially if it's having their first kid, and it's an exciting and a fun challenge. And so sometimes when I'm talking to the patient about those challenges, I've developed some kind of insight that I could give them some advice from a more personal level, not related directly to the medical things, but because as a parent I've probably been through similar challenges, and having done the job for a while, I've probably talked to many young couples about those challenges.